here have ever been injured? Raise your hand. How many people here have ever been in pain? Raise your hand. How many people here have ever been injured and not have pain? I see one hand. Good. Oh, okay. All right. Well, the next slide here on page 3 here, you're going to see 3 buckets. And the 3 buckets basically represent the 3 different categories that you can find yourself in. The first one is pain-free injury. And this is kind of an oddball one for people because they don't realize that this can happen. I'm going to let you in on a secret. Your body is constantly healing itself. So most of us have probably had injuries that we didn't even know about, that our body healed and we had no pain from. So you should just keep that in the back of your mind as we go through these. What we're going to do is we're going to go through each of the questions that you answered and we're going to talk about them. Okay? So you can have pain-free injury, you can have painful injury, and that's mostly what we're kind of used to, but you can also have injury-free pain. That's when pain persists long after the injury is healed or in the absence of injury completely. And we're going to talk about kind of how that can happen. So first, I want to talk about just real quickly the definition of pain. Everybody knows what pain is, right? So you probably, if I were to go through the room and ask you guys to define pain, I'd get quite a variety of responses, but they'd all probably be along the same lines, right? So there's actually a definition of pain. There's an international organization that devotes itself exclusively to studying pain. And the definition that they've come up with is that pain is an unpleasant, obviously, unpleasant sensory and emotional experience that is associated with actual or potential tissue damage. And there's a couple key things I want you guys to pay attention to there. One is that it is sensory and emotional. It's not just about the physical things that are going on. Pain has a very strong emotional experience. Yes?
So sometimes when you have so much pain and you can only handle so much, then you start to cry and that gives you a release?
Absolutely.
And I got sick once. My back was hurting so bad that I actually got sick, physically sick, and after I vomited, I felt better.
Mm-hmm.
I mean, it's true.
Pain is not a straightforward thing that we experience. It's very complex, and it incorporates multiple parts of our body and our mind in the experience of pain. So we can't boil pain down to just a simple thing like, oh, we get injured and we have pain. It's more complex than that. So the other part of this definition that I think is important is that it says that it's associated with actual or potential tissue damage. I want you guys to do a little experiment with me. You take your hand, I want you to push with your thumb onto your forearm. Push. Just put a little bit of pressure there. Does that hurt? No? Maybe a little. Now push really hard. Does it hurt now? Yeah. Did you hurt yourself? Did you damage your body when you did that? No. No. Right? But it created pain, right? There wasn't any tissue damage, but you created some pain. What that tells us is that your body sometimes will create pain as in advance of what it thinks might be bad, just to let you know that, hey, if you continue down this road, you might hurt yourself. So
it's like a warning.
Exactly. You are exactly right. She said it's like a warning system, and that is 100% correct. That's pain's primary function, is to warn us of potential danger. Okay? So let's go ahead to the first question. The first question is it possible to have pain and not know about it? Did we get any truths? Yeah. It's actually not possible to have pain and not know about it. It's possible to have injury and not know about it, but it's not possible to have pain and not know about it. You will always know that you have pain. Okay? So, easy points. All right, next page. When part of your body is injured, special pain nerves convey the message to your brain. Shall we poll the crowd? True or false? I see a little bit of everything. True, some false. The answer is actually false. We don't have dedicated pain neurons. But here's this kind of a trick question, because if a lot of you were in school, like when I was in school, we were taught that we had dedicated pain neurons. That's actually not true. We've learned from more research that that's not entirely true. We have danger signal neurons. Those are nerves that are dedicated to identifying possible risks in the body and sending that message to the brain. But just because the brain receives the information from the body along those nerve pathways does not necessarily mean that we're going to have pain because of it. The brain then has to interpret the information. Okay? So when you are looking forward at me and you see me, what you're seeing is a bunch of electromagnetic waves hitting your eyeball, and then your eyeball translates that information into electrical signals that go to your brain. Your brain then has to interpret that image into something that's meaningful so that you understand what you're looking at when you see me. It's the same thing with our hearing, right? So eyes, vision, and hearing are both complex sensory perceptions. They're more than just information. The brain has to interpret it to determine what it is and give it meaning. That's the same thing with pain. Pain doesn't happen until the brain decides that it needs to happen. So the brain is constantly evaluating information coming up from the body and also information coming in from around us, outside of our body, right? Has anybody ever watched somebody have an accident? They fell down the stairs or something and you cringe. Ooh, that hurt. It didn't hurt you, but you imagined that it hurt somebody else. And sometimes people will actually have sympathy pains. How many people here have been married? Yeah? Okay, how many people here have had children? Okay, yeah. How many husbands had sympathy pains when you were pregnant? Yeah, right? Yeah? I see some raised hands. They weren't hurting. They weren't having anything happening to them, but yet they experienced physical pain out of sympathy because their brain saw somebody in pain and it caused them to experience pain themselves. So what we're learning here is that pain is not actually produced in the body. It doesn't happen in our knee when we hurt our knee, and then the knee sends signals to the brain saying, hey, I hurt myself, there's pain here. That's not actually what happens. What happens is when we hurt ourselves, say we hurt our knee, it sends signals to the brain just telling the brain what happened. And then the brain determines whether or not that's dangerous to it or not. And that's why some people can have injury without pain. A lot of times those people don't even know they got injured. So we don't actually have pain nerves, we actually have danger nerves. And those danger nerves operate as part of our pain system to warn us of potential threats that we might need to deal with. So let's go to the next question. Okay? It says pain only occurs when you're injured or at risk of being injured. False. Very good. People with no pain have all the same diagnoses as people with pain. The difference is how the brain perceives the tissues and the processes in question. So, anybody here ever had a back injury? Oh yeah. How many times have you heard somebody tell you, oh, you hurt your disc, right? Or you've got spinal stenosis, right? Or you had a fracture of one of your vertebral segments. Yeah, right? Well, what they've done a lot of research into this actually, and what they've discovered is that all of those processes are completely normal. Arthritis is normal, stenosis is normal, disc injuries are normal. Those degenerative processes that happen as we get older, they're normal. In fact, one physician actually described it as like having wrinkles on your face only on the inside of your body. They're just normal facets of aging, like getting gray hair or developing wrinkles as we get older. And the reason we say that is because everybody has those. They've done MRIs of healthy populations starting in their 20s all the way up through to their 90s. And all of those people have spinal stenosis, herniated discs, and arthritis. But the people that they MRI'd, none of them had pain. Not a single one. So when you look at healthy populations, people who don't have pain, they have all the same signs of those people who have pain, who are ascribing the pain to the spinal stenosis or the disc injuries or the, fractured vertebral segments and things like that. So when somebody tells you, oh, you have spinal stenosis, you probably do, but that doesn't necessarily mean that you have to have pain with that. And that's good news, because if pain was the direct result of those degenerative processes, we'd never be able to get rid of your pain, ever. Nothing would ever be able to solve the problem. But because we know that pain is as much about perception, it's how the brain is interpreting the information it's getting from the body regarding the whatever changes that are happening in our body. Perception is something we can change, right? We can educate people, we can do things to help them move better that will actually cause their brain to not feel threatened by those processes. So here's an example. I went in, I was helping a patient who had fallen and broken her wrist. So I was doing some balance training and some fall risk, things with them, helping her to make sure that she didn't fall again. And I was talking to her a little bit about pain, just like I'm talking to you. And she says to me, so I had an accident 15 years ago, and I've had back pain ever since. What you're telling me is that the reason I have back pain is because my brain still feels threatened by that area where I got injured. But it's actually healed and it's fine. And I'm like, yes, that's what I'm telling you. And she goes, oh, well, that's really cool. I saw her again in a month. After, we worked with her, and I came in and I talked to her again for a month, after a month, and she says, I want to tell you that I haven't had any back pain since I talked to you. So for 15 years, she had a constant back pain. And in one conversation, her brain, the switch flipped, and she realized that wasn't a threat to her anymore. Her back pain went away. And so for a month, she'd had no back pain. Had another patient who I went in to see her neck. She was having pain in her neck. She had a fall, broke her hip. For some reason, the physician x-rayed her neck. And when she woke up from her hip surgery, told her that she had severe arthritis in her neck and didn't know why she didn't have pain. And so the patient, from that day forward, had severe neck pain because the physician told her she had arthritis. Now, she'd always had arthritis. That didn't change overnight, but she wasn't aware of the fact that she had arthritis, and she just kept moving on with her life, and everything was good. She couldn't move her neck, but she didn't have any pain with that stiffness. She just thought it was just stiff, and she couldn't move it. But all of a sudden, now she had arthritis, she had pain. So she got some physical therapy. We went in there and worked with her. I told her, I said, we can absolutely help you with your pain problem. And she says, well, you can't cure my arthritis. And I told her, you're absolutely right. I can't do anything about your arthritis. I said, but I can help you to change how you perceive the arthritis in your own body. We can get some movement in there. We can create some physical stimulation to help calm the nervous system down. And after 2 months of therapy, she was able to say that she'd gone off of all of her pain medications. She didn't have any pain anymore. She still had a stiff neck. She still had arthritis, but she didn't have any pain anymore because she was no longer perceiving the arthritis as a threat to her. It was just part of who she was. And so that makes a big difference, how the brain perceives the information. So we can have things happening to us. We can have injury. We can have degenerative changes that happen as we get older, like arthritis and disc disease and all of those things, including spinal stenosis and all those things that go with that. And they can affect us, but we don't necessarily have to have pain with those. They can cause pain if your brain sees them as a threatening experience, but they don't have to. Because you can change your perception. You can change what you understand and believe. You can't necessarily change the disease process all the time. So that's a good thing. Let's go ahead and go on to the next question. So when you're injured, special nerves convey the danger message to your spinal cord. True or false? It's true, absolutely true, yeah. We don't, remember earlier we said we don't have pain neurons, we actually have danger neurons. So the nerves that are in our body are constantly sending signals up to your brain. And in the brain, the first place the nerves hit, they go through a set of filters. Is this relevant? Is this bad? Is this good? Is this irrelevant? And your brain has to interpret that. If we were to be consciously aware of all the information that your brain is filtering, it would drive us crazy. It would be so much noise. So your brain is constantly filtering information, and some of it just shuts down. Some of the signals, it just shuts down automatically. It can do that to some signals. It can do that to all signals. Right? So that's kind of something to just keep in your mind. Your brain has the ability to shut off pain. The strongest pain medicine in the world sits between your ears. We have yet to be able to come up with anything that is more effective at dealing with pain than the person's own brain. So information is carried from the body up to the brain through the spinal cord, and then the brain then decides whether or not it's important or not, whether or not it's going to shut it down or pass it on. And when it gets passed on, the brain then interprets it. Is it good? Is it bad? Is it a threat to me? Is it not a threat to me? Okay? So, but when it first comes up, it's not a pain signal yet. It's just a danger signal. All right, let's move on to the next one. Special nerves in your spinal cord convey danger messages to your brain. True. True. You noticing a theme? Right? Yeah. So the body has special nerves that are dedicated to sensing potential danger. We have a name for those nerves. They're called nociceptors. Yeah, that's a fun word. So when these nerves fire, they send information to the brain, and depending on how the brain interprets it, they may interpret it as pain. If it interprets it as pain, you will experience the pain where the brain thinks the problem is. Right? Anybody here ever had a heart attack? Okay. When you had a heart attack, did you feel the pain in the middle of your chest? Where did you feel the pain? In your back. Yeah. So some people have silent heart attacks where they have no pain whatsoever, yet they had tissue damage because that's what a heart attack is. There's pieces of the heart actually died, but they didn't have any pain with them. Some people have pain, but they felt it in their back or their shoulder or their jaw or their left arm. I mean, those are classic symptoms, right? Yes. Yeah, yeah. The heart can actually create pain. Well, I say create pain. It can trigger pain anywhere below your eyes and above your waist. So if you're having pain anywhere below your eyes and above your waist, it could be the heart that's actually triggering those signals to the brain. Yes?
My daughter has had several heart attacks, but when she went to the ER, they told her she was having a panic attack. So she had several of those. In fact, she was even taken to the ER in an ambulance at one time.
It can be hard to discern the difference sometimes.
So her doctor just here, well, it'll be a year ago this October. She had was at the doctor's office, and she told him, she says, you know, I've got a pain in my back that just don't seem to want to go away.
Yeah.
And he listened to her heart and sent her to the hospital.
Good for him.
The back side of her heart so badly damaged they couldn't do open heart surgery.
Wow.
They put in 4 stents.
Well, it's a good thing he listened to her heart. So here's the walkaway point with that, right? Is that sometimes we can have tissue damage, but we'll feel the pain someplace else, right? A lot of times when we have back problems, we feel the pain in our legs, our hips, our knees, or our toes. But the problem is actually happening up here in the spine. Sometimes when we have heart attacks, we feel the pain in our arms, or our jaw, or our back, or someplace else. But the problem is actually happening in the heart muscle. So where we feel the pain is dependent upon where the brain thinks the problem is. Whether or not we feel the pain is dependent upon whether or not the brain thinks there is a problem. Does that make sense? So let's go ahead and move on to the next question. All right, so nerves adapt by increasing their resting level of excitement. True, yes. Nerves can become more excited or less excited. Like, this is boring, right? And what do you think happens when a nerve becomes more excited? Sometimes pain. But basically what happens when a nerve becomes more excited is it gets easier, it's more sensitive. It's easier to get that nerve to fire and signal up to the brain, right? So, if I've got a person who's running a race, say I'm going to have Josh and Kelly run a race against each other. And because Josh is really super fast, so I'm going to make Kelly give her an advantage. I'm going to put her halfway to the end mark before, and have them start from 2 different places. Right? Which one do you think is going to get to the end first? Kelly. So when a nerve level of excitement is increased, that means it's halfway to the firing point already, or closer in some cases. So that means, like, maybe normally it would take 6 pounds of pressure to get that nerve to send a signal to the brain. Well, now it only takes 3 pounds. So do you think that the brain's going to get more signals from that nerve or less? More, right? So when a brain's getting more signals from a nerve area than it's used to getting, that can cause the brain to suddenly feel concerned that maybe something bad is going on in that area, right? Especially if it already knows something bad has happened in that area, right? So anybody here ever had surgery? Yeah, in the area around this where you had surgery, was it really, really, really painful to touch for a while after you had surgery? Yeah, it's very sensitive. Yeah, it doesn't happen that way for everybody, but a lot of times that's what happens. If you've had a knee surgery, the area around the knee is really, really tender. Okay? And that's what happens a lot of times, is the nervous system becomes really super excited, and when it does that, it becomes super sensitive. When it's super sensitive, it sends a lot of signals to the brain that previously it wouldn't have sent. So the brain is then interpreting all that extra information as threatening, as potentially threatening, potentially bad for the body. So that's one of the reasons why we have pain when the nervous system is super excited. But here's the good news. If the brain can cause a nerve to become more excited, it can also cause the nerve to become less excited. It can calm it down. And that's what we're learning so far, is that pain is actually an output of the nervous system as a whole, the brain and the nerves in our body. It has very little to do with actual tissue damage itself. So that means that that's something that we can affect, because we can't always control whether or not something is changed, right? Our cartilage is changed. How many times have you heard somebody say, oh, I have bone on bone in my knee?
I've heard that.
Yeah. So whether or not you have bone on bone in your knee isn't actually the problem. The problem is that the brain is perceiving that that is a problem, right? So what we believe about our knee, how we feel about our knee, that's actually part of why the brain is feeling threatened by the fact that it has bone on bone. And so that's where the pain's coming from, is the brain is concerned that that's a problem. So we can't necessarily, apart from replacing the joint, we can't necessarily cause the cartilage to grow back. But what we can do is help the nervous system to calm down, help the brain to perceive that differently, and then that causes the pain to get less. And in some cases, go away. So there are a lot of different things that can cause a nervous system to become more excited. And so the good news there is that it can become less excited. All right, let's go ahead and move on to the next question. Chronic pain means that an injury hasn't healed properly. What do we think? So a lot of people are going to say true. It's actually false. Yeah. Chronic pain, so the tissues heal themselves. Our body is an amazing, amazing thing. My car doesn't fix itself when something goes wrong. I have to take it to a mechanic, and he has to explore and figure out what's going on. And then he's a lot like a doctor, only for cars, right? So, but when he finds the problem, he doesn't say, okay, just let it sit in the garage for a while and don't use it, and give it a week or so, and that thermostat will start working properly again. It doesn't work like that. So, but in our body, a lot of times, that's exactly what happens. If we take away the inflammatory stimulus, that thing that's making it, have problems, a lot of times it'll completely heal itself. Case in point, right? So when I was in school, I read a case study on a girl who had received a heart transplant. She was a little girl. She had a heart abnormality. Her heart was going into failure. She was about 9 years old. And the kind of heart transplant that they did was the one that they didn't actually take her heart out. They just put another heart in and hooked it up. So both hearts were beating. She had 2 hearts in her chest. Okay, so she gets to be about mid-20s or so, and they have to go in there and do another heart replacement. So they opened up her chest, and they went and unhooked the other heart and realized that her first heart had completely healed itself. This is simply because it didn't have to work very hard, and all the load had been taken off of it. In that time frame, they hooked her original heart back up to her. Yeah. I mean, that's a rare occurrence. That's not something that is going to happen, but it just shows the incredible extreme nature that our body has to heal itself. When it comes to muscles and bones and ligaments and tendons and stuff like that, our body will almost always heal itself. So when we have issues where our pain is persisting long after the original area or time frame from when we got injured, we call that chronic pain. Chronic just simply means it's been going on for a long time. So when we have that happen, it's very, very rarely because the area didn't actually heal. Generally only in disease states where there's something that's affecting our body's ability to heal itself, in which case we got something else going on, right? Our body will almost always heal itself. In fact, studies have shown that disc injuries will oftentimes heal themselves without any intervention from a doctor or a physical therapist or anything else within 6 months to 2 years on its own. In about 50% of cases, that's the case. So, and like I said earlier, you get any 10 people together in a room, 4 of them have disc injuries and don't even know it because they have no pain. And then you MRI them 6 months to 2 years later, those disc injuries have healed and they never even knew it. So, and these are studies that have been done that have demonstrated this. So chronic pain does not actually mean that the injury hasn't, that area is a threat to it, right? Maybe our nervous system in that area has never calmed down. So the brain is still getting all these signals from it.
And if it's like arthritis, like I have, it's pain. And so it can't really heal itself. It gets better and worse, but activity always helps. But it doesn't eliminate it.
No.
Sometimes it's almost unbearable in my neck and my back.
So arthritis is an example of a disease process, right? To an extent that inflammation is getting kind of out of control in there and it's causing accelerated bone degeneration. The best thing in the world for arthritis is movement.
Yes.
Yeah. And that's what medicine has shown us, is that the best thing in the world for arthritis is movement. It's the best thing to prevent it. It's the best thing to slow it down. It's the best thing to keep it from keeping your joints all locked up and stiff. So the thing, though, is that when you said that your pain with your arthritis comes and goes.
Yes.
Yeah. So the degenerative process of arthritis is a constant progressive state. It doesn't get better and then get worse and then get better and then get worse. Right? So arthritis is constantly working and doing what it does. But our experience of the pain with our arthritis comes and goes based off the time of day, based off the weather changes. See, that doesn't make sense if we're thinking that arthritis is actually causing the pain. What does make sense is if we understand that it's how the brain is perceiving that process that's going on in our body. And sometimes the brain may say, I'm not worried about it right now. And so our pain is a little bit better. Other times it goes, oh, I'm really worried about it. And so then our pain gets worse.
I see it as cycles.
Yeah.
In my life. It gets better, but then it stays bad for a while too, say a week or more even. It's almost unbearable, and then it recedes some.
Yeah.
It comes back again, and I'm just glad when it's not here.
Absolutely. Glad when it's not there. Yeah. But it's not actually the arthritis that's cycling out. It's how your brain is perceiving that arthritis. It's how it's what's going on in the nervous system as a whole. What's going on in the brain. It's how emotionally, it's the stresses that are going on in your life that are affecting it. It's the thought patterns that you're having that's reflecting. Pain is a complex thing. It's not just a simple. I mean, I'm making it simple, but it's really complex. So, you had a question.
Yeah, what about torn rotator cuff? I've got
So, torn rotator cuffs. A rotator cuff is a set of muscles, and muscles actually have an incredible ability to heal. And even the rotator cuff has an incredible ability to function even when it's torn. So my mom had a torn rotator cuff. She had an MRI in her shoulder due to something else, actually. And they found that she had all 4 of her rotator cuff muscles were almost completely torn. She had no idea. So the rotator cuff is a pretty amazing set of muscles and pretty strong. So yeah, rotator cuff can cause pain. In the sense that it's triggering pain. I mean, there's no doubt about that. But again, it's not the torn muscles themselves that are causing the pain, that are generating it. It's actually the brain and how the brain's perceiving that experience. But muscles, a torn rotator cuff, as long as the muscles are still connected, they still have the capability of healing. And even if they don't fully repair, the muscle itself has an incredible ability to still function even in a torn state. Imagine a really thick rope. And so somebody comes along with a knife and cuts a few fibers along the outside edge. So that's a torn rope. That's effectively what we're looking at when we have a torn rotator cuff. We have some tears along some of the fibers. That doesn't necessarily mean that the rope isn't strong. It still probably pull a tugboat. But it's not as strong as it was before. That's a given. But it's still capable of functioning, and what's causing the pain is the brain and its perception of the rotator cuff. Does that make sense?
The pain is down here.
Yeah.
When I have my
Yeah.
rotator.
Because that's where the brain thinks the problem is. Yeah. Okay. We're almost done here. Let's go ahead and see if we can't finish up some of these last questions. Worse injuries always result in worse pain. False. The intensity of the pain is directly correlated with how bad our brain thinks the problem is. So how much does it feel threatened? Not how bad the injury is. Things like stress, anxiety, fear, depression, illness, among others, can act both as triggers and as amplifiers to pain. All right. Next question. Neurons traveling down from the brain are always off switches. False. Yeah, the brain is constantly regulating information coming up from the nervous system and down from the brain. So it can be both an on switch or an off switch. And that can explain why we have pain sometimes, because the brain is actually sending a signal down that's causing a nerve signal to then increase signals up. All right, pain occurs whenever you are injured. What have we learned? False. People have injuries without pain all the time. So our bodies are very, very powerful healing agents. Not like our cars. All right. When you injure yourself, the environment that you are in will not affect the amount of pain you experience as long as the injury is exactly the same.
That should be false.
That's false. Look at people in car accidents versus drivers in demolition derbies. Car accident victims have tremendous amounts of pain sometimes, but demolition derby people have no pain from their impacts in their car accidents that they have in demolition derby because they view it as fun. So they're running head-on into each other at 30 miles an hour, and they get the same whiplash-type experience, but they have absolutely no pain with it at all. And this has been documented with scientific studies. So how we perceive the experience that we have where we receive the injury is oftentimes very powerful into our total pain experience.
So the next time we're going to get in a car accident, just think of it as a demolition derby.
Yeah. When you see that you can't get out of the way, maybe, no, I'm not going to say that. All right, next question. The brain decides when you experience pain. True, that's exactly right. The brain is the supreme controller of our bodies. It interprets all the information we receive and labels it as either good or bad. So if the brain experiences something and it thinks it's bad, it may cause pain, or it may not. So here's the big question everybody really wants to know. What can we do about it? Right? Well, like I said before, pain is a very complex thing, and there's no such thing as fake pain. People don't make pain up. Your pain is 100% real when you experience it always. And so one of the things that we need to be looking for is kind of like what's triggering that pain. So that we know it's generated by the brain, but what's triggering it? So when we identify what's triggering it, we might want to back off those things a little bit and start trying to move into other ways of doing it, and then build out. Eventually, we want to get into those movement patterns that were triggering it and see if we can reprogram the brain that that's not a bad thing. But basically, we want to exercise more. We want to move more. We want to sleep well, because if you don't get very good sleep, then that's going to feed into your pain experience. And we want to eat right. Because nutrition, good sleep contributes to overall good health, and that contributes to better pain. And most importantly, we don't want to be afraid of our pain. Okay? If we let fear rule our pain experience, fear is like gasoline on a fire. It will make our pain experience tremendously more powerful than if we weren't afraid of it. So that's it. Thank you very much.